Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Dr. Hamid Khoja. He's joining us here as Chief Scientific Officer at FibroBiologics. It's a regenerative medicine company developing treatment for chronic diseases using fibroblasts. He's going to tell us what fibroblasts are and how they could replace stem cell technology. Welcome to Health Professional Radio. Dr. Khoja, thank you for taking the time.
Yes, thank you very much, Neil, for having me. I think people know stem cells quite well. They've been in the news often in the last couple of decades, but fibroblasts, not so much. Fibroblasts are one of the most abundant cells in the human body. They're very easy to obtain, but they also have a lot of characteristics that are quite similar to stem cells. They can differentiate into different type of cells like adipocytes, chondrocytes, astrocytes, and even epithelial cells. But they also have the capability of modulating immune system as well. So they could be used for a variety of different clinical outcomes, such as multiple sclerosis, degenerative disc disease. We're also looking at the possibility of utilizing it for cancer as well.
Although extremely common in the human body, are these fibroblasts produced in all organs of the body?
Yes, so fibroblasts appear in all organs and all tissue types.
Yes,
they are the cells that generate the connective tissue for the entire system, human body. So very predominant. And if you're just wondering in terms of the abundance ratio between fibroblasts and stem cells, fibroblasts outnumber stem cells by a factor of 10 to 12,000. So for each stem cells, there's typically 10 to 15,000 fibroblasts. Fibroblasts are also very easy to grow, very easy to culture, very easy to isolate as compared to stem cells.
Are stem cells and fibroblasts the only thing that can be used to regenerate tissues and organs?
Yes, so mostly stem cells and pluripotent cells are what are used for tissue regeneration in the human body or any mammalian or non-mammalian systems. But typically, these days, for a lot of the clinical trials as well as preclinical studies, either mesenchymal stem cells are used, or in our case, we are using fibroblasts instead.
As far as these fibroblasts are concerned, are they indicated for specific types of cell tissue or organ regeneration, or can they be used for any type of organ or tissue?
No, that's a very good question. So there are many subtypes of fibroblasts with different outcomes in terms of how they grow. So for some of the clinical indications, for example, for multiple sclerosis and degenerative disc, we grow these cells specifically to be destined for either becoming chondrocytes or as an immune modulation for multiple sclerosis. So these cells are specific, they're cultured, grown, and activated specifically for different outcomes.
So as far as these different outcomes, are we talking just diseases that destroy tissue, or are we talking other types of illnesses as well?
There's a variety of different diseases, not necessarily just degenerative. For example, tissue regeneration, we're looking at it also for a variety of different applications, for example, such as cancer. We're also looking at regenerating certain immune organs like thymus and spleen. And we're also looking at, of course, multiple sclerosis, for which we have quite a significant amount of preclinical and clinical trial data.
Now, is this clinical trial data both in animals and human studies?
Yeah, our preclinical trial studies have all been done on animal models. But we just in August of 2020, we completed a small-scale clinical trial for use of fibroblasts, these tolerogenic fibroblasts and multiple sclerosis. It was a small study. It was a safety-based study. and the results look quite promising. It was very safe to administer these cells at high concentration, but we also looked at some efficacy endpoints as well, which look promising.
Do fibroblasts have the ability to reproduce themselves, to regenerate themselves, or do you have to introduce them on a regular basis to the patient?
No, so what we typically do, what we've done in some of our clinical trials is the testing. Since it's safety-based, we've tested a single dose of these fibroblasts. For example, for the multiple sclerosis, we did an infusion of 100 million tolerogenic fibroblasts, a single dose, and look at the safety endpoints as well as some efficacy endpoints. No, they don't regenerate themselves in the human body. We don't expect that to a great extent. So my assumption is that for a larger clinical trial, we'll look at not only a single dose, but we would look at repeated multiple doses over a period of time, as well as different concentration of dosage.
What about regaining function in limbs? Will they regenerate tissue enough for nerve function and muscle function, able to regain any dexterity?
Well, yeah, I think that's overreaching it a little bit. I think the potential is certainly there. There's some good publications that fibroblasts and fibroblast growth factors are involved in some of the tissue regeneration in that regards. But I think that is still there still has to be a lot of research done for that. But I think in terms of some tissue regeneration, like, for example, for multiple sclerosis, on animal model studies, we've noticed that fibroblasts were able to help regenerate the myelin sheath by stimulating oligodendrocyte expansion. And also for degenerative disc disease, for which we've done quite a bit of preclinical studies, we've been able to show that it can generate chondrocytes, which are basically cells that produce the disc height. So we've been able to see some results that have been very promising. We're looking forward to doing larger clinical trials to see if these are indeed efficacious and to what degree.
Who is a good candidate to initially harvest these fibroblasts from, as far as age, illnesses, health, anything of that nature?
Right. So how we isolate these fibroblasts and grow these fibroblasts are from tummy tuck surgical waste. So these are cells that are grown from a very small biopsy punch. And of course, we do have inclusion and exclusion criteria for these donors for using their tissues for growing these cells. And we, of course, like anyone else, we monitor for pathogens, whether viral, fungal, or bacterial, of the donors, but also during the culturing and growth process.
Well, doctor, if you would give us a website where we can learn more about FibroBiologics and about fibroblasts in general.
We suggest that people look into FibroBiologics.com. It has a list of our patents. We have a very large patent portfolio, but also information on fibroblasts and how they differ and are similar to stem cells.
I appreciate you joining us here on Health Professional Radio, Dr. Khoja. Thank you so much for your time.
Thank you very much, Neil. I appreciate having this discussion with you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Hamid Khoja. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.